Bismillah ar-Rahman ar-Rahim. Today we're going to talk about chronic myeloid leukemia. What are leukemias? Neoplasm of white blood cells and its precursor, clonal proliferations and accumulation of cells in marrow. They classify as acute leukemias and chronic leukemias. This table here shows the types of leukemias. They are acute and chronic, lymphocytic or myeloid. Lymphocytic like acute lymphocytic leukemia and chronic lymphocytic leukemia. Myeloid is acute myeloid leukemia and chronic myeloid leukemia. This picture here shows the myeloid cell and lymphoid cells and their ending at lymphocyte, erythrocyte, platelets, monocyte, neutrophil, eosinophil, basophil. Introduction to chronic myeloid leukemia. It's a clonal malignant myeloproliferative disorder characterized by increased proliferation of the granulocytic cell line without the loss of their capacity to differentiate. Results in an increase in myeloid cell, erythroid cell, and platelets in peripheral blood and marked myeloid hyperplasia in the bone marrow. It originates in a single abnormal hematopoietic stem cell. About epidemiology, incidence is 1 per 100,000 people. Accounts for 15% of all leukemias in adults. Median age is 53 years old, varying from 40 to 60 years of age. All age groups, including children, can be affected. It increases with age and are higher in men than women. Etiology is not clear, but little evidence of genetic factors linked to the disease. Increased incidence in post-radiation therapy and Nagasaki and Hiroshima survivors. Leukemogenesis. Philadelphia chromosome is an acquired cytogenetic anomaly that is characterized in all leukemic cells in chronic myeloid leukemia. 90 to 95% of chronic myeloid patients have Philadelphia chromosome. Reciprocal translocation of chromosome 22 and chromosome 9. PCR, a gene on chromosome 22 fused to the ABL gene on chromosome 9. Philadelphia chromosome is found on myeloid, monocytic, erythroid, megakaryocytic, B cells, and sometimes T cell. Prove that chronic myeloid derived from pluripotent stem cell. Molecular consequences of translocation of chromosome 9 to 22 is the fusion protein PCR-ABL, which has increased in tyrosine kinase activity. BCR-ABL protein transform hematopoietic cells so that their growth and survival become independent of cytokines. It protects hematopoietic cells from programmed cell death. Clinical features. Disease is biphasic and sometimes triphasic. 40% is asymptomatic. Chronic phase. There is splenomegaly, often massive. Symptoms related to hypermetabolism, weight loss, anorexia, lassitude, night sweat. Features of anemia like pallor, dyspnea, tachycardia. Abnormal platelet function like bruising, epistaxis, menorrhea. Hyperleukocytosis. Lab features. Bone marrow is hypercellular. Myeloid erythroid ratio is 10 to 1 to 30 to 1. Myelocytes predominant cell and blasts less than 10%. Megakaryocytes increased and dysplastic. Increased reticulin fibrosis in 30 to 40%. Other lab features like neutrophils alkaline phosphatase is reduced, serum B12 and transcobalamin increased, serum uric acid is increased, lactate dehydrogenase is increased, cytogenetic Philadelphia chromosome is present. Phases. Accelerated phase. This is an L-defined transitional phase. Median duration is 3.5 to 5 years before evolving to more aggressive phases. Clinical features: increasing splenomegaly, refractory to chemo, increasing chemotherapy requirements. Lab features: Blasts are more than 15% in blood. Blast and promyelocytes are more than 30%. Basophil is 20% in blood. Thrombocytopenia, cytogenetic clonal evolution. Blastic phase resembles acute leukemia. Diagnosis requires more than 30% blasts in marrow. Two-thirds transform to myeloid blastic phase and third to lymphoid blastic phase. Survivor 9 months to 3 months, comparing between lympho and myeloid leukemia. Principles of treatment: relieve symptoms of hyperleukocytosis, splenomegaly and thrombocytosis, hydration, chemotherapy, control and prolonged chronic phase, alpha interferon and chemotherapy, imatinib and chemotherapy. Eradicate malignant clone, allogenic transplantation, alpha interferon, imatinib mesylate, tyrosine kinase inhibitor that specifically block the enzymatic action of BCR-ABL fusion protein. It's a first line of treatment. Prognosis: several characteristics of chronic myeloid leukemia affect the prognosis, including age, spleen size, white blood cell and platelet counts, and percentage of blast, eosinophil, and basophils in the peripheral blood. This is our reference. Thank you for listening.